Okay, so good evening everyone. So we are here with the MDS 360-degree session for our MCQ based discussion, which we take from Monday to Friday every 5 days of different subjects. So today myself, Dr. Rijul Agarwal, I am the orthodontic faculty at AIIMS with the session on orthodontics, and I am going to discuss MCQs on that subject. So those who are listening and are live, I request you two guys to participate. I'm not taking a exam here to highlight that this is wrong, you are wrong, or you are right. We are here to discuss the questions application, because in exams theory jitna bhi pad le, we have to apply our brain, we have to solve MCQs and give answers to it. Okay, so good evening, we have people joining up. Okay, so I request everyone to give you the sense of maximum participation and solve and give answers to those questions. Where you are wrong, I'll help you out and to decipher the final correct answer. Okay, so as I said, myself Dr. Rijul Agarwal, I'm the orthodontic faculty at AIIMS. So the first question. Which of the following statement is correct regarding the size of the face at birth and adulthood? So a comparison based question to compare the size of the face with respect to the size of the cranium at birth and adulthood. Okay, the face forms, option 1, the face forms 2/3 the bulk of the head, whereas in the adult it forms 1/3 the bulk. Face forms half the bulk of the head throughout the life. Option C, the face forms 1/3 the bulk of the head, whereas in adult it forms 1/8 of the bulk. The face forms only 1/8 of the bulk of the head, whereas in the adult it forms 1/3 to half of the bulk. So in our class we have studied the proportion of the head with respect to the body. Now here I am asking the proportion of face with respect to the total head dimension. Okay, so let's see who can answer this question. It's alright as well if you are wrong, but I want you to apply your brain. Okay, because questions like this, questions to honge definitely in an exam, which are out from your notes, out of your study material, and that's why we are here to sit and answer those questions. Looking at the options, option B is, अगर हम जनरल प्रोपोर्शनलिटी भी देखें बॉडी की. Okay, there is the answer. I'll open this diagram. Okay, this is the very landmark diagram. The head size is more as compared to body, and slowly it decreases. Earlier it appears approximately 50% of the proportion of the body, and slowly it decreases. Okay, now here option B is directly ruled out, so that gives us with option A, C and D. Option A, the face forms 2/3, whereas in adult it forms 1/3. Face forms 1/3, whereas in adult it forms 1/8. Whereas option D, it forms 1/8, whereas in the adult it forms half, 1/3 to half. So the correct answer is option D. Okay, in your AIIMS exam where the seats are very less, if by somewhat you are able to eliminate 2 of those options and you're remaining by 2 only, so I'll request everyone to give their best attempt in that exam out of the remaining 2, because questions like these generally come in your AIIMS exam, options being very close. Okay, concept पढ़ा लगेगा, options बहुत nearby होंगे. Okay, to confuse you. So if you are able to narrow down your question to 2 or remaining options, do give an attempt to solve that question. Okay, Next, the Meckel's cartilage gives rise to which of the following structure? An easy question: condylar cartilage, coronoia, ramus, or none of the above. Let's see who can answer this. It's a very easy question. I cannot claim that it's entirely orthodontics question. Meckel's cartilage gives rise to which of the following structures? Embryological based question. Students who have attended my class, also last week only itself we discussed this. So based on this last week topics only, I prepared my questions. Okay, none, then I'll answer it myself. So Meckel's cartilage provides a scaffold, or what is a scaffold? A base on which the mandible is laid down. So technically it does not give rise to any of the structure of the mandible, neither condylar cartilage, neither coronoia or other name for coronoid process, neither ramus of the mandible. So the correct answer is none of the above here. Okay, so it's a cartilage derived from the first arch. So what does it gives rise to? It gives rise to the bones of the middle ear, that is the malleus and the incus. Okay, it does not play any role, no role in the development of mandible. Just acts as a scaffold or base for the developing mandible. Next question. Read the following carefully. Spino-occipital synchondrosis, mandibular cartilage, frontomaxillary suture, nasal septum and alveolar process. Out of the following, which of the following are the sites of cartilaginous growth postnatally? Questions like this with multiple answers correct are part of your AIIMS exam. Okay, here option is one only correct, but out of the following statements or given statements, there are multiple answers which are correct. Okay, so these questions like this part of your AIIMS exam. So here, to attempt these questions, you have to narrow down or rule out and then look at the options which best fit that those of the narrowed down ones. I'll give, if anyone wants to answer, give a minute or two for you to read and tell. First is spino-occipital synchondrosis. It is the cranial base synchondrosis. What is a synchondrosis? It is like a epiphyseal plate. Oh, someone answered it as B. Anyone else? So it's a cranial base cartilage which grows and closes postnatally. Mandibular cartilage, again, it's a cartilage which is it's a primary cartilage or primary in origin, although it's a secondary cartilage which remodels and it is responsible for increasing the length of the mandible. Frontomaxillary suture. Now out of all the sutural system, okay, frontomaxillary, circummaxillary suture system, they are ossified by the help of intramembranous ossification. That is, directly bone is laid down. 1, 2, all ossified by the means of endochondral ossification. So this is removed. Fourth, nasal septum. So nasal septum is also formed from cartilage which extends its growth postnatally. And lastly, alveolar process. Alveolar process is a bony structure formed by intramembranous ossification and grows with the help of eruption of teeth. So which of the following structure or sites are responsible for cartilaginous growth postnatally? So 1, 2 and 4, and hence which is the correct? Option B. So yes, you're right, option B is the correct answer. This was also a PYQ question of INIOT. Okay, someone has joined late. So frontomaxillary and alveolar process are sites of intramembranous bone formation, whereas spino-occipital, mandibular cartilage and nasal septum are the sites of cartilaginous growth both pre and postnatal. Next question. Marked anterior mandibular growth rotation. So which of the following statement is correct? Occurs when growth in posterior facial height is less than that of anterior facial height. Is often associated with deep overbite. Associated with an increased maxillary mandibular plane angle. Associated with the concave lower mandibular cord. Now there is an anterior growth rotation occurring of the mandible. Right now we are here to discuss those questions. So if possible, those who have a pen and paper in their hand can draw the diagram to simulate the anterior growth rotation and arrive at the correct answer. C. Okay. Anyone else? It's a very easy question. If you're able to draw the diagram to visualize this image, this will help you, because growth rotations and all are understood with the help of diagrammatic representation only. You have to draw the diagram to assess, then only you'll be able to answer. Okay, so this is the cranium base, maxilla and mandible. Now it is saying anterior rotation means mandible is like this, rotates up. I'll draw this with a different pen. Now it is like this, it has rotated up. So what will happen? Occurs when growth in posterior facial height is less than anterior. So if it is rotating up, so there will be decreased anterior facial height and increased posterior facial height. So option A is eliminated. Is often associated with deep overbite. When the mandible rotates up like this, the anterior teeth goes up, so leads to deep overbite. Hence this is the correct one. Still we'll read the other two. Associated with increased maxillary mandibular plane angle. Now since the mandible is rotating up, the mandibular plane angle decreases, so it should be decreased. That is, there is horizontal growth pattern. Hence this is also wrong. Associated with the concave lower mandibular border. Mandible goes up, so the lower border becomes convex, not concave. So this is also. So option B is the only correct statement here. A, C and D are all pointing towards posterior growth rotation of mandible. A, C and D. This topic on growth rotations is a very important topic for your exam. Please, and very topic which needs to be understood thoroughly. Okay, so option B. So individuals with short facial height and short anterior facial height have excessive forward rotation of the mandible during growth, resulting in increase in the normal internal rotation and decrease in external compensation, matrix versus intramatrix rotation. This will lead to horizontal palatal pain, low mandibular plane angle and a square gonial angle, deep bite and a crowded incisors, lower incisors, packing of the incisors, known as this condition, packing of the incisors, known as imbrication. A very important term for your MCQ. Growth rotations which we studied. Next question. The antigonial notch is prominent when mandibular growth is forward and upward, forward and downward, downward and backward. Antigonial notching prominent in all types of mandibular growth pattern is same. I'll complete the statement. Is same. Question similar to the one I drew you the diagram as well, so a very easy question for you to answer. Someone says C, HS says C, it says A, antigonial notch is prominent. Kindly don't remove your options, even if you're wrong or right, because in exam साइड की स्क्रीन पे अगर आप देख के अपने ऑप्शन बदल दोगे will create trouble for you. Sometimes you're right as well. So what is antigonial notch first of all? So it is a notch present on the lower border of the mandible. Now what happens in mandibular growth rotation? Either the whole mandible can rotate based on the center of rotation as it is located at the condyle, in forward rotation I am talking now, or at the incisor or in the center. Similarly in vertical at the condyle and at the center. Okay, so either the whole mandible can rotate or either the anterior part can rotate, depending upon whether it's a matrix versus intramatrix, what kind of rotation is occurring. If irrespective of that fact, if it rotates up, what will happen? From here it will go here. So I just told you in the previous questions as well. Anterior rotation, it goes up. The lower bottle will become flat or convex. So it becomes flat or convex, so the prominence of the antigonial notch will decrease. So in forward and upward rotation, the prominence will decrease. Forward and downward, forward growth and downward rotation. And lastly, third option, downward and backward. Option D is eliminated. No, even without looking at it, you can tell that it's not the correct. So downward and backward. So mandible is going down and back. So in doing that, the lower border becomes convex, increasing the prominence. Hence, it's the correct. Forward and downward. True, downward increase, but forward grows does not increase that much prominence as compared to downward. So any day C is more appropriate or more correct than B. Hence C is the correct answer. I hope you guys have understood why C is the correct answer. Just draw the diagram, visualize the rotation of the mandible like this, whether it's going up. If it's going up, the lower border will become convex, so decreasing the prominence. Going down, concave, increasing the notching or prominence of the antigonial notch. Similarly, in the previous question as well, I told you, anterior rotation is associated with convex. So convex means like this, lower border is convex, so antigonial notching की prominence will decrease. Okay, so as I've told you, 2 questions on growth rotation. Today my MCQ sessions will be like this only. I'll discuss topic wise questions. Okay, small topic, so that by the time we reach your exam, we are able to complete and cover all of the course and cover all of the MCQs. The initial sign of sexual maturation in boys usually is. अब सारे PYQ में आपको मिलेगा girls. Now I have asked about it boys. Fat spurt, change in voice, growth of pubic hair, or all of the above. It's a direct table pick question. Stages of maturation from Prophet, which I showed in the class. Stage 1, stage 2, stage 3. Girls 4 stages, boys 3. Should have the initial sign they have asked. Should have put up the fourth. Supposedly the fourth option is increase in height. A. Anyone else? Sixth, D. Someone says B. Now D option is increase height. Not all of the above. All of the above is too easy. No one is going to pick up that option. Okay, I modified the fourth option to increase in the height. Initial sign. Basically the child is boys moving towards pubertal growth spurt. Initial. You have A, D and B. No one with C. So the correct answer is option A. Fat spurt. Okay, so this is the table. So stage 1 is in boys is fat spurt or weight gain. Stage 2 is beginning of the height spurt and pubic hair growth. Stage 3 is peak height velocity and stage 4 is ending of the growth spurt. So this is stage 1, this is stage 2, stage 2. And height is or change in voice is also shown towards stage 2. Okay, important thing about this table, I have discussed this a number of times. This is a very important table for your NEET as well as INI. Peak height velocity stage 2 in girls, whereas it is stage 3 in boys. Beginning of the menses in girls means there is growth spurt ending, means no myofunctional appliance therapy. No myofunctional appliance therapy. So only stage 1 and 2 you can give myofunction. Similarly in boys, stage 1 and 2 only, beginning of the height spurt, not at peak height velocity. Fixed functional appliance, removable myofunctional stage 1 and 2, fixed function myofunctional stage 3, then 3 and 4 in boys. The questions like this you get: a mother reports to your clinic with a chief complaint of protruded mandible. On examination, on a supplementary examination, you observe that the mandible is positioned backwardly. What kind of appliance? Okay, the child is in stage 3, or you can say beginning of menses. What kind of appliance will you give? Wait for some questions like this. Big paragraph based question, clinical based, scenario based questions you get in your exam. So do remember and understand the significance of this table. Okay, next question, 7th. The first structure which develops in the primordium of the lower jaw is mandibular division of the trigeminal nerve, a single ossification center for each of half of the mandible. Ossification, not classification, sorry for that. Mesenchymal condensation forming the second brachial arch, mesenchymal condensation forming the first brachial arch. Now the lower jaw is formed from the first brachial arch, you all know from embryology basics, so C is directly eliminated. So what is the correct answer? I've just directly eliminated the one option. You are left with 3 options. 7A. Anyone else? Very easy question. I think I'm more towards discussing anatomy and embryology today rather than towards orthodontics. This highlights that in your need that 14 division of the question, 14 from this carries no such significance because the questions can overlap and come from any side. Mesenchymal condensation forming the first brachial arch. Someone says option D. Okay, so mandible develops from 2 ossification centers which appears in the mental nerve area. They ossify towards each other and meet in the midline. Okay, Now ossification structure cannot be the first structure because you need to have a scaffold or something for it to come. So option B is eliminated. And as I told you, if you are able to narrow down your answer to two options, then you have to attempt it. So we cannot leave this question now. That leaves us with option A and option D. Option A says mandibular division of the trigeminal nerve, and option D says mesenchymal condensation forming the first brachial arch. So students, in class we have all discussed that for any bone, for maxilla or mandible to ossify, first there should be a nerve supply or scaffolding to come, and then based on that neurogenic potential the bone formation begins. Remember the unloaded nerve complex criteria. That is, first the scaffolding nerve comes, there is some neurogenic potential, then the mesenchymal condensation and the bone forming cells come. Hence option A is the correct answer. The first structure to develop is in the primordium of lower jaw is the mandibular division of the fifth cranial nerve. Then there is beginning of the mesenchymal condensation forming the first brachial arch. So the condensation proceeds around the nerve so that the nerve is protected and is unloaded so that no damage comes to it. Okay, nerve, by nerve I means both the neurovascular bundle. Why? Because there are neurotraffic factors produced by the nerve. Neurovascular means nerve and the blood vessels both. Nerves provides the stimulus, blood vessels provides the nutrients and the cell supply essential for bone formation. Okay, the osteogenesis at the ossification center starts around 6th month of intrauterine life, and it spreads below and around the inferior alveolar nerve and its incisal branches. Okay, both in the left and right side around the initial ossification site. So first mesenchymal nerve comes, then mesenchymal condensation, then the ossification. Similar kind of mechanism occurs in the maxilla as well. First there is infraorbital nerve, the maxillary nerve and its components which come, the neurovascular bundle, and then the ossification starts. In this type you need to remember the number of ossification centers, both primary and secondary for maxilla and mandible. Next, a big question. Okay, so I need to write this. Okay, so a big statement, big question. Okay, so primary cartilage seen in the head and face is identical to the growth plate cartilage of the long bones. Okay, they have the capacity to grow from within and are present and are pressure tolerant, non-calcified, flexible, non-vascular, and do not have nutrient membrane covering. Which of the following statement is not correct as far as the role of the primary cartilage during growth in human being is concerned? It first appears in the head during the 5th week prenatally. The overall influence of the primary cartilage on craniofacial growth is most profound in late life. By mid-childhood, most primary cartilage is replaced by bone through endochondral bone formation. By birth, the primary cartilage comprises a substantial portion of the nasal septum and the cranial base. So what is the correct? So students, one tip and big tip and trick, since the statement is like this, okay, someone has answered it as B, is the bigger the question, the easier it is to answer. Itna bada question this examiner generally forms so as to test your skill and knowledge and aptitude, whether you can handle such pressure like situations or not. Believe me, half of the people, when they click on next question and see this much big question, they do not even attempt to read it and move on. Keep on 1 minute because वो timer चल रहा है. Now you have a section wise division. बढ़ जाएगा. We'll attend this question at the last if we get time. the bigger the statements or the questions are there, the easiest it is to answer. The smaller the size of the question, the difficult it is for you to answer. Okay, so they are generally simply asking you the incorrect statement about primary cartilage, ignoring the above big paragraph which they gave, and just to pass your time and waste 20-30 seconds of your time. So it first appears in the head during 5th week prenatally. It appears prenatally, correct. 5th to 8th week it is said. The overall influence of primary cartilage on growth is most profound in late life. No, it is most profound in the intrauterine life or early life. Hence, this is the incorrect and correct option. Even if you don't know what is primary and what is the correct, you know primary is primordial first cartilage, so its effect needs to come first, not in the late life. That is the role of the secondary cartilage. So that's why I said the bigger the question, the easiest for you it is to solve. Now it is the simply correct. Okay. Second or third option, mid childhood most primary is cartilage is replaced by bone through endogonal bone formation, and lastly by birth the primary cartilage comprises of the nasal septum and cranial base, which we just studied. So this is the differentiating table between primary and secondary cartilage, okay, which we started in our lecture in class. You can go through them for your quick revision. We'll move towards the next question. Question number 9. Sir, getting some background noise. Okay. Close the door. Just a minute. Is it fine now? If it's fine, we'll move towards the next question. In the previous question, I mentioned you in the last slide, whether before it was interrupted by the sound of that bike, the difference between primary and secondary cartilage. This is a differentiating table. Primary, as I told, is a primary or primordial, जो first पहले आता है. Okay. Secondary जो बाद में आता है, that comes second. Okay. Now, important thing which you need to know is the example of primary and secondary cartilage. So, secondary cartilage, the biggest or most important, the mandibular condyle. Why it's important? Because it is primary in origin, but is the example of secondary cartilage. So, this becomes a type of assertion reasoning type of question. State assertion. Mandibular condylar cartilage is an example of secondary cartilage. Reason: mandibular condylar cartilage is of primary in origin. Option A, both assertion and reason are true and is the correct explanation. Option B, assertion, reason both true but not correctly explanation. Option C, assertion is true, reason is false. So if you don't know, most will mark option C, because in the statement A it's written secondary cartilage but primary in origin. So it is a secondary cartilage but it is primary in origin. Okay, why we have discussed, so we cannot discuss that why is the reason why it's called secondary cartilage despite it being primary in origin, because of its pathological features, because of its function. So moving ahead, someone answered the 9th question as well. So according to Moss, growth of periosteal matrix brings about translation of microskeleton, transformation of microskeleton, translation of macro, transformation of macro. So Melvin Moss theory, it's based on the functional matrix hypothesis. So One person HS has answered it as C. Anyone else? So functional matrix hypothesis divided into two parts, two components. There is skeletal unit and there is functional matrices. Skeleton unit is of two parts, micro and macro, and functional matrix two part, capsular matrix or the periosteal matrix. What is periosteal? Periosteal matrix is the immediate local surrounding matrix. So periosteal matrix brings about the effect on the microskeleton, and capsular is the bigger thing. So in craniofacial region we have two capsules, the orofacial and the neuromuscular capsule, neurocranial capsule. Okay, it comprises of the bones, blood vessels, everything contained within. So it is influences the macroskeleton. So we have asked about periosteal matrix. So macro options are eliminated. That leaves us with two options, option A, option B. Now we have to attempt this question, a direct question from your notes. Okay, those who have listened, attended the class would have been able to easily answer it. Okay, so it is transformation of microskeleton. Periosteal matrix का biggest or more example. Now we'll understand with this with the help of example. So the attachment of temporalis muscle on the coronoid process. So what does functional matrix story says? Stretch the soft tissue, move the soft tissue, and the bone will grow. So soft tissue in this case can be anything, blood vessel, muscle, nerves, or anything. So temporalis muscle, what does it say? Growth of the soft tissue influences the growth of the hard tissue. So temporalis muscle attachment is on the coronoid process. It moves, hence it transforms or grows the coronoid process, which is the part of the microskeletal unit of the mandible. So similarly we have the coronoid process, the body, the ramus, all are comprised of many microskeletal units together form the one complete mandible. And growth of the capsular matrix translates or pushes the macroskeleton, hence it is translation of the macroskeleton by this capsule. And together these capsular and periosteal matrix influences and regulates the growth of the craniofacial region. That is what the functional matrix hypothesis states. So option B is the correct answer. The change in size and shape, so it's transforming the size. So Moss called it as intraosseous growth or transformational growth, and capsular matrix causes expansion to passively change its position, known as translational growth. Next question. Which of the following statement is not true as far as achondroplasia is concerned? Incorrect statement. Examiner confused, not true, not correct, just to play with your mind at that time, like the exam. They could have simply written as which false or incorrect, but they write is not true, not correct. The anterior cranial base is of normal length. The anterior cranial base is of short length, transmitted as autosomal dominant trait. The posterior cranial base is of short length. So what is achondroplasia? If you remember that image, You'll be able to answer. Very easy. Ten. Someone's HS says B. Anyone else? Okay, so what is achondroplasia? So achondroplasia, first of all, it's a autosomal dominant condition in which the primary cartilage of the limbs and cranial face fails to grow. Okay, so there is diminished growth in the cranial base sutures. Okay, mainly at the spino-occipital, intersphenoid and sphenoethmoidal synchondrosis, leading to, and as I've told you, cranial base sutures अगर grow नहीं करेंगे, there is no proper growth in the cranial base. उसके नीचे is attached the nasomaxillary or the mid face, so it also does not grow in the forward, leading to deficiency in the mid face, known as a skeletal class 3 will occur. Okay, hence the anterior cranial base is of normal length and the posterior cranial base is of shorter length, and plus there is it's an autosomal dominant, plus there is mid face deficiency. So hence option B is the correct, because it's an incorrect statement. Okay, important is it can come as a image based question as well. Yes, you're right, dwarfism, frontal bossing, all are there. Okay, so we have studied embryology, we have studied oral pathology. I deliberately pick up these kinds of questions because students are generally adamant about that 14 question का जो एक landmark है. I have repeatedly told you these questions overlap from each and every subject. Okay, it's also part of orthodontics as well because of the genetic regulation theory, the achondroplastic gene and all that. And this is all picked up from your standard textbook of orthodontics, that is from Contemporary Orthodontics by William R. Prophet. Next question, again a big question. Now, the question says, observation and study of growth pattern during development of human being is one of the very basic aspects of growth studies. So it's based on the studies of growth. Now, the study of growth is in height is one of the most common pattern of such study. Which of the following statement is true for a child who falls beyond the average measurement for his or her age? Okay, study in growth in height. Such a child is always considered as abnormal. Child is always considered as normal. Such child, even though we are showing towards abnormal trend as per the growth in height is considered, but are not necessarily abnormal. Assumptions. So please take one class on appliances, image based and uses. It's already available on the app. Now we are discussing based on MCQ, but I'll try because it's already all the appliance images I've sorted and summarized them in one. Students, the problem with is you are all focused towards image based question, appliance image, appliance image, appliance image. It is important, but it is not the only aspect. If you pick up the previous year questions of this, even this previous INI exam as well, approximately 30 to 35 questions came. Hardly there are 4 to 5 appliance based, image based question, you can say. And you are more focused towards only image, appliance image. They are important, but they are not the only aspect. And I can assure you, the images which you know, okay, everyone will know. 80 to 90% will be able to answer, because they are very well taught to you in exam. You daily see. What you don't know is not clear with the theory part. But not to worry, I'll take up image based questions as well in my MCQ, because in the end we need to solve MCQs. We don't have a theory, or you don't have a spotter exam in like this you used to have in your graduation. Okay, you identify the spot, you have an image based question or MCQ based. So what kind of question will come based on that images, I'll take up in my subsequent sessions. Okay, not to worry with that. So coming back to the option D, assumptions cannot be predicted for such a child. So it's based on the concepts of growth and development, pattern, variability, timing. So in variability also, I told you. So again, I'm telling you, images are important, but not the only part. Hardly comprise of 20 to 30%. And as I told you, coming back to this question, the bigger the question, the easier is for you it is to answer, because it is not twisted at all. Just test your basic knowledge. So yes, it is option C, that even it's an abnormal trend, growth trend, but not necessarily abnormal. So remember the bell-shaped curve, the child falling outside the 97th percentile is not necessarily considered abnormal, but for weight and age, and it's studied because the timing of the growth is not same for everyone. It varies. Some are fast early growers, some are slow growers. So you cannot say with definitely that okay, this is falling outside, this is abnormal growth. Okay, so hence option C is the correct. Okay, so with this I conclude my today's session. Okay, we'll be back next week with another set of MCQs for us to discuss. Okay, so I request everyone to please attend these sessions. Okay, answer questions. Okay, because the exam is not far away. August is there. In a few days time the notification will come out for the November INI CET exam. November के बाद आता है NEET, again the May INI, the cycle goes on. So do not think this is, I repeatedly say this in my session, this is a quiescent or relaxing period. Festival season is approaching. Okay, but celebrate the festival after you get your desired post PG seat. That's my message to you. Okay, we are also taking classes, taking sessions for your benefit only. Okay, so that the concepts, the application is clear. If you have any doubts, anything related to orthodontics, I repeatedly tell you, do not hesitate to reach to me. I'll be very happy to answer all your queries related to orthodontics. Any question, any book, anything. It's not necessary. I always say, some people ask me, sir, which book to refer? I say any book which says MCQ there for dental subject. What should be the strategy for upcoming INI CET in the last 3 months? I don't have an empty page space. Okay, I'll write here. First, revise notes. Second, do MCQs anywhere you can get hand on. It is not necessary to focus MCQ on one book, any book which says MCQs for dental entrance examination. Any book which says that there are n number of books, Pulse, Neeraj Sir's book, any book, DAMS question bank, our question bank is there. Okay, any book, anything you can get a hand on, do those MCQs, solve those MCQs, because solving MCQs is the only thing which will help you gain confidence कि जो आप पढ़ रहे हो it is of relevance, whether you are in the right direction or track or not. Okay, just studying, because people ask me, sir, shall we start studying from standard textbook? It is not impossible at all. Okay, 4 years you have given for 19 subjects. In the 5th final year you cannot go through the standard textbook of all the subjects and hope to clear the exam. No. Okay, and lastly, most important thing, and third, PYQ of INI MDS only, not MDMS, MDS only of last approximately 10 years, starting with the latest May INI CT. And fourth is, once you are thorough with this, I'll write this in black because people start with the fourth. If you get time and hand on, if, again I'm saying, if you are able to get SR questions, do not start creating panic. We don't have SR question, that guy has, that person has, he has done it, I'm not. Okay, the examiner sitting there making the paper does not start by picking the question from SR question bank. No, never ever it has happened. If you are thorough, done with the option 1, 2 and 3, then only move, and you have ample amount of time, you are free for 3 to 4 weeks, now you have nothing to do, then only go for 4, and if you can get hands on them as well. Do not create panic ki I don't have it, where will I get it, etc, etc. It's available on our DAMS Alpha app. Questions are there. Okay, you can go through them, but only in the condition when you have done with the first 3 things. And PYQs of MDS only. So people start picking up MDMS questions and think they will come. No, it's not humanly possible for you guys to understand and even answer. At one time that question came from there. No. Okay, so that's what I can say, I can guide for you. Revise and solve MCQs. I'm not stopping anyone from pointing towards do only this book, paper will come from only. No, any book which says MCQs for dental entrance examination, PG dental entrance exam, solve it, because every question look at it with the aim, not ki aayega, look at it ki that I am able to answer it, and I am able to answer it by eliminating all the other 3 options, because the rest 3 options can make 3 more questions. Okay, so that's what I can say. In our discussion also, I also eliminate other options before pointing towards the correct and explain why other 3 are incorrect and other 3 what they are correct for. Okay, if you start mugging up the MCQs ki nahi ye aayega, it's not possible, because approximately by the time you reach your exam you would have seen a minimum of 50 to 60,000 questions. On an average अगर 100 क्वेश्चन भी देखे तो उससे ज़्यादा ही हो जाएगा होंगे, एंड इससे पहले का भी अगर टाइम आया था. Okay, and if possible you are enrolled up in test series, start attempting grand test, complete course test. Do not wait for your course to finish and then only, because that time will never come. Even the toppers of any exam, you see their interview, it's not they say that we have completed the course and then. Okay, so that's all from my side. We'll keep up meeting every week. Till then, any doubt, please do ask. Thank you.